Hello, everyone, and welcome to this audio podcast. This audio podcast, as part of a quantum edition, this audio podcast as part of a Vortux Gauntlet, this audio podcast as part of a Lobostic sequence, and this audio podcast as part of a Storm Robotics production. In this audio podcast, looking at sort of research poster presentation works, research poster presentation works regarding looking at CVD and CKD, thus chronic kidney disease and cardiovascular disease, looking at the two aspects in context of what is referred in the literature as a sort of a collaboration between between cardiology as a specialty and also looking at nephrology, and where in amongst in literature is referred to as cardio-nephrology, and so this sort of research poster presentation was works that had been part of an a healthcare awareness event in around 2014, and where the RPSG team, the Renal Patient Support Group team, had shared the had shared some of the sort of the had shared some of the sort of literature. I had shared some of the literature in sort of a research poster presentation, sort of a research poster presentation in a sort of research poster presentation format, and the aims and objectives of this works was looking at CKD and CVD, and looking at this in context of in context of cardio sort of nephrology. So the aims of this was where we're looking at where CVD can only be understood if there is an appreciation at all levels of healthcare, which obviously branch into community, hospital being clinical, scientific being laboratory medicine, and pharmaceutical where pharmacotherapy is concerned. And whilst predominant complications sort of in sort of pre in pre sort of transplant sort of transplanted in pre-transplanted patients, pre-transplanted patients can include, for example, vascular disease, vascular disease, clotting and thrombosis, infection, malignancies, and bone disease. The objective of this research poster presentation for this during this as part of this healthcare awareness event that took place in 2014, was to sort of elaborate on CKD and cardiovascular complications, chronic kidney disease, and cardiovascular complications, sort of synonymously. So the background to this is where cardio and nephrology sort of share the entities in the care of patients, including those who are for example transplanted transplanted, and in line to aspects of clinical pharmacology, looking at aspects of clinical pharmacology, aspects of ischemia, or where ischemia can exist, and sort of the sort of as and including sort of an emphasis on the on clinical pharmacology, being where chemokine and cytokine receptors and their ligands sort of have been looked at have been looked at in have been looked at in amongst in amongst cardiac allografted rejected cardiac allograft rejection, and particularly where the in particularly in regard to the chemokine receptor CXCR3, where authors in around 2000, between 2000 and 2002, investigated sort of the role of the sort of fundamentals around chemokines and their receptors in amongst sort of transplanted rejection transplant rejection in amongst transplant rejection, and following more following sort of more work had highlighted the importance of cardiology and nephrology sort of associations sort of in following sort of the works that have been published by authors between 2000 and 2002. And so in regard to chronic kidney disease, CKD specifically, the functions of the kidneys are multiple and tend to be taken for granted. And to name a few, they are involved in regard to arterial blood pressure, hormone homeostasis, acid-base balance, calcium and phosphate metabolism, excretion of waste produce, and plasma volume control. Universally, CKD or chronic kidney disease is characterized as a disease that's more linked to the elderly. However, this is a misconception. Is a misconception. CKD affects all ages and affects all ages, all ethnicities. CKD tends to establish as a secondary complication in context of how evidenced it has been in amongst literature. However, now that cardiovascular complications can be prevalent in can also be prevalent CKD in CKD sort of has become a priority with both acute kidney injury or AKI, for example, and chronic forms that stem from a variety of physiological, immunological, pathological, hematological, and biochemical complexities, ultimately becoming multi-systemic. In regard to relating now to CVD and cardiovascular disease, so understanding the cardiovascular system and current practices requires a sense of a sense of understanding sort of the literature, and a sense of understanding the literature. But since cardiology is also a fairly intricate division of medicine, conventionally practices in both sort of nephrology or renal and cardiovascular care have been evidenced as being sort of clinical, and there has been an increase in sort of the collaborations or collaboratives in line to scientific and experimental research that have advanced with specific and particular sort of clinical practices. CVD is perhaps one of the most common causes of death. Perhaps one of the most common causes of death amongst sort of suspect or high risk recipients or patients, and literature affirms or informs sort of the same epidemiological risk of for coronary artery disease or CAD in the general population are operational are operational in for example in amongst transplanted recipients. Studies have informed that coronary revascularization surgery can sort of present sort of survival advantages in transplanted recipients with low risk of impairment in renal function. The research poster presentation now goes into sort of looking at hemodialysis and complications. So long-term hemodialysis protocols do contribute complications. The hemodialysis regimen is and can be intense, causing vascular complications. Hemodialysis comprises of myocardial comprise of myocardial comprises of so implications around myocardial function comprises or compromises myocardial functioning. The dialysis recipient or recipients are also predisposed to symptomologies that are linked to stroke. And literature as far as the late 90s inform for example, that symptomology is aligned to hypertension occurs early in the course of chronic kidney disease, and by the time recipients by the time recipients are prepared for hemodialysis. For example, 75% to 80% of patients are chronically hypertensive, and wherein 50% have left ventricular hypertrophy or LVH. Ischemic acute myocardial infarction is probably has been evidenced in the literature as now being the most probably or perhaps being the most common cause of non-infective sort of post transplant death. There is more literature highlighting post transplant sort of thrombosis in populations of patients or cohorts with particular symptomologies, and it is noteworthy that such patients are predisposed to myocardial risk patterns. Complication and the poster presentation now looks at sort of the complication some of the complications sort of in sort of post transplanted recipients. So one team explores the impact on a renal allografted outcomes. The team declare that particular symptomologies raise the risk of pre-operative complications such as wound infections, delayed wound healing, hernias, and deep vein thrombosis or DVT. Amongst the literature, has been evidence that many sort of pre-transplanted recipients with CVD with CVD complications are becoming endemic in allografted recipients. In works again sort of from the late 90s, from the late 90s, it has been evidenced, it has been evidence there has been evidence to inform that 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 sort of a raised ABP, arterial blood pressure, or ABP, will ensure sort of a high perioperative risk in asymptomatic patients. So those patients with known particular symptoms or symptomologies, but also where literature informs, or where the author of particular works in the late 90s, affirm that it had become apparent that though normalizing renal function, normalizing sort of a sense of renal function in transplanted recipients, this has not dented an impact on the progression of CVD. So thus, through transplantation, for example, it does not. So, for example, where amongst the literature that that authors inform that CVD can still be part of the sort of symptomologies that link to aspects of morbidity. Then in regard and sort of in following this research poster presentation from 2014, looks at sort of aspects around pharmacotherapy, pharmacotherapy sort of more specifically. So we're better control of adverse immunological events during and within the sort of post-transplanted duration, and where graft or allograft loss can occur, and caused by a sort of where rejection significantly can reduce sort of a successful prolonged prognoses, can reduce sort of prognoses, can reduce prognoses. This in amongst the literature has been documented or evidenced as still in part still being somewhat common. Long-term immunosuppression and corticosteroid treatment can raise particular biochemical parameters, and the status of the myocardium, and cyclosporine, for example, as an immunosuppression, historically in recipients, has been associated with a 2.5-fold increased risk of ischemic heart disease, amongst the literature, where tacrolimus a cyclosporine or CSA equivalent immunosuppression is found to be associated with lower levels of ABP and prevalence lower levels of ABP, and in turn there is and tends to be sort of better graft or allograft functioning at 2 year sort of 2 year sort of post transplanted in post transplanted recipients compared with CSA or cyclosporin based therapy. Immunosuppression and complications, and the complications can be sort of broad ranging, and no one sort of pharmacotherapy is superior to another. And then in this research poster presentation, there is a little bit of a focus around the basis of the Renal Patient Support Group, the RPSG, as part of a sort of an outline of some of the works in around the RPSG. So the RPSG had been primarily a non-funded social media platform, sort of co-developed by colleagues, by collaborators in the Southwest region, in the United Kingdom in around 2009. The RPSG is or has been sort of internationally sort of recognized as a patient focused or patient based and sort of patient care sort of social media platform. And at the time of this research poster presentation, there had been around 5,000 healthcare service users utilizing the utilizing the social media platform. There have been 10 or 11 members as part of the administrative and research team, with representation from representation from UK, Europe, and Australia and the United States, who are involved in facilitating and moderating the social media platform. The RPSG aims to raise CKD awareness in regard to all CKD stages, with members providing and sort of providing insight in regard to lived experiences. In regard to lived experiences, and the RPSG has also sort of prompted an understanding on topics surrounding CKD. And in regard to transplantation, the social media platform has generally lent itself well to raising CKD awareness, owing to sort of where varying healthcare service users utilize the social media platform to help inform sort of healthcare and healthcare services, and amongst those who are early stage amongst early stage CKD, and throughout sort of the CKD pathway. And the RPSG is also and has published works in regard to sort of renal and related sort of specialisms, by and through sort of collaborative efforts, and to ensure sort of the prompting in regard to healthcare sort of best practices. And the RPSG, at the time of this particular research poster presentation, the RPSG had also been had also had a secondary social media platform, being which had been which had been accessible for those who are, for example, non Facebook users, thus being the blogspot, or the blogger which journal which journals which journalizes certain and specific specific sort of activities through the RPSGs. So in summary, as part of this particular research poster presentation, this poster presentation, as part of a healthcare awareness event that took place in the Southwest region in the UK in 2014, education and sort of a lifestyle sort of focuses in amongst the literature have been important in context of the link between between the specialisms, cardiology and nephrology. Clinical and medical interventions can cascade further CVD or cardiovascular disease events, and where mechanistic interventions tend to be the sole pathway, and care needs to be sort of meticulously sort of planned by specialists to avoid sort of aspects of traumatization, and there is a need to distribute information regarding ongoing sort of guidance or advice to patients whom have received sort of who are recipients of allografts, and indeed at the same time in regard to pharmacotherapy, whilst there has been amongst the literature sort of a sense of dominance in around aspects around pharmacotherapy, surgical interventions at the same time have been on the increase has been on the increase since within the literature the two where as far as the two specialisms are concerned, for example, cardiology, cardiology and cardiovascular implications, cardiovascular implications can result wherein, for example, patients and recipients of allografts do not or are not sort of in sort of compliance to particular forms of treatment, and so in amongst literature sort of from the mid 2000s, works by authors had informed. More recently, clinical and epidemiological studies demonstrated that cardiac disease is a frequent complication of advanced chronic kidney disease and the major cause of death in patients on renal replacement therapy. So in conclusion, as part of this research poster presentation, The kidneys are sort of are sensitive and sort of intricate, and once diagnosed, CKD is irreversible. Measuring measuring endothelial function, so that's blood flow through through sort of through through particular arteries and veins to identify myocardial occlusions can be helpful. Comprehension of disease markers or biomarkers following transplantation is now on the is and has been on the increase, and almost routine practice among specialists. The science linking cardiovascular complications is sort of is and has been getting better. However, research is required on prevention in regard to biomarkers of CVD, and more awareness and understanding of cardiovascular events. Of cardiovascular events need to be proactively implemented as part of patients as part of patients' care plans, and age and sort of gender adjusted cardiovascular risk is increased approximately fivefold higher in renal transplanted recipients. Immunosuppressive agents that have revolutionized transplantation have direct have and can have sort of direct effects on cardiovascular risk on cardiovascular risk factors, and contribute not only to premature cardiovascular disease, but also to the increased risk of malignant disease and death, and sort of death or morbidity due to infection. So that draws this audio podcast to a close. This audio podcast in regard to cardio-nephrology and looking at this research sort of poster presentation in regard to chronic kidney disease, cardiovascular disease or CVD, looking at aspects around sort of the complications in amongst post-transplanted recipients and those amongst in the hemodialysis hemodialysis population, and looking at some aspects of pharmacotherapy, and looking at some of the earlier sort of works or works in regard to the Renal Patient Support Group, the RPSG, in regard to the RPSG from its conceptual work from 2009. So that draws this audio podcast to a close. There will be some a list of references or citations that listeners can check out alongside this audio podcast. This audio podcast is part of a quantum edition. This audio podcast as part of a Vortux Gauntlet. This audio podcast as part of a Lobostic sequence, and this audio podcast as part of a Storm Lobostics production.